Angina pectoris. Introduction. Angina pectoris, commonly known as angina, is a clinical syndrome characterized by chest pain or discomfort resulting from reduced blood flow to the heart muscle, myocardial ischemia. It is typically caused by coronary artery disease, CAD, due to atherosclerosis, plaque buildup in the coronary arteries. Angina is a major symptom of heart disease and is often a warning sign of an impending heart attack, myocardial infarction, if left untreated. Definitions. Angina is chest pain or discomfort caused when the heart muscle does not get enough oxygen-rich blood. It may feel like pressure or squeezing in the chest and is often triggered by physical exertion or emotional stress. Angina pectoris is a clinical syndrome characterized by discomfort in the chest, jaw, shoulder, back, or arm due to myocardial ischemia, often precipitated by exertion or stress and relieved by rest or nitroglycerin. Etiology. 1. Coronary artery disease, CAD, most common cause. Atherosclerosis, plaque buildup leads to narrowing of coronary arteries. Thrombosis, blood clot formation in a narrowed artery can reduce blood flow. 2 other causes of myocardial ischemia. Coronary artery spasm, prinzmetal angina, temporary narrowing of arteries due to smooth muscle contraction. Aortic stenosis, narrowing of the aortic valve, reducing blood supply to the heart. Hypertrophic cardiomyopathy, HCM, thickened heart muscles restrict blood flow. Severe anemia, reduced oxygen carrying capacity of the blood. Tachyarrhythmias, abnormal heart rhythms, increase heart's oxygen demand. Cocaine use, can cause coronary artery spasms and ischemia. Risk factors. 1. Non-modifiable risk factors. Age, more common in individuals over 45 years. Gender, males are at higher risk, postmenopausal women also at risk. Family history, genetic predisposition to coronary artery disease. 2 modifiable risk factors. Hypertension, high blood pressure increases strain on the heart. Hyperlipidemia, high cholesterol promotes plaque buildup. Diabetes mellitus, accelerates atherosclerosis. Smoking, damages blood vessels and reduces oxygen supply. Obesity, increases heart workload and cholesterol levels. Sedentary lifestyle, lack of physical activity raises heart disease risk. Stress, chronic stress can contribute to hypertension and heart disease. Unhealthy diet, high fat and high sugar diets increase cholesterol levels. Types of angina. 1. Stable angina, exertional angina. Occurs predictably with exertion or stress. Relieved by rest or nitroglycerin. Due to fixed coronary artery narrowing, atherosclerosis. 2. Unstable angina, pre-infarction angina. Occurs unexpectedly, even at rest. More severe, prolonged, and not relieved by rest. Sign of impending heart attack, acute coronary syndrome. 3. Prinzmetal angina, variant angina. Caused by coronary artery spasms, not atherosclerosis. Occurs at rest, often in early morning hours. May be triggered by cold exposure, stress, or smoking. 4. Microvascular angina, syndrome X. Affects small coronary arteries instead of major arteries. More common in women. Symptoms persist longer than typical angina and may not respond to nitroglycerin. Pathophysiology. Atherosclerosis in coronary arteries. Down arrow. Narrowing of blood vessels and reduced oxygen supply to myocardium. Down arrow. Imbalance between myocardial oxygen demand and supply. Down arrow. Myocardial ischemia, temporary lack of oxygen in heart muscle. Down arrow. Chest pain, discomfort, or other symptoms of angina. Down arrow. Relief with rest or nitroglycerin, in stable angina, or progression to heart attack, in unstable angina. Clinical manifestations. chest pain or discomfort, tightness, pressure, or squeezing sensation. Pain radiating to arms, jaw, neck, back, or shoulders. Shortness of breath. Nausea or dizziness. Sweating, diaphoresis. Fatigue or weakness. Palpitations or irregular heartbeat. Diagnostic evaluation. 1. History taking. Onset, duration, and character of chest pain. Triggers, exertion, stress, and relieving factors, rest, nitroglycerin. Associated symptoms, dyspnea, nausea, sweating. 2. Physical examination. Blood pressure and pulse assessment. Signs of heart failure, swelling, abnormal heart sounds. Check for risk factors, obesity, smoking history. 3. Specific tests and procedures. Electrocardiogram, ECG detects ischemic changes. Cardiac biomarkers, troponin, CKMB rule out myocardial infarction. Exercise stress test, evaluates heart function under exertion. Coronary angiography, visualizes blockages in coronary arteries. Echocardiogram, assesses heart function and wall motion. Medical management. 1. Lifestyle modifications. Smoking cessation. Regular exercise. Heart healthy diet, low fat, high fiber, low sodium. Weight management. Stress reduction techniques. 2. Pharmacological management. Nitrates, nitroglycerin relieves chest pain by dilating blood vessels. Beta blockers, metoprolol, atenolol reduces heart workload. Calcium channel blockers, amlodipine, diltiazem improves blood flow. Antiplatelet agents, aspirin, clopidogrel prevents blood clots. Statins, atorvastatin, rosuvastatin lowers cholesterol. Surgical management. Coronary angioplasty, PCI with stenting opens blocked arteries. Coronary artery bypass grafting, CABG bypasses blocked arteries using grafts. Nursing management. Nursing diagnosis, acute pain related to myocardial ischemia. Interventions. Assess pain characteristics, location, duration, intensity, triggers. Administer prescribed nitroglycerin, sublingual or 4, to relieve chest pain. Monitor vital signs and ECG for ischemic changes. Encourage deep breathing and relaxation techniques to reduce anxiety. Educate the patient on avoiding triggers such as stress and heavy meals. Nursing diagnosis, ineffective tissue perfusion, cardiac, related to coronary artery disease. Interventions. Monitor for signs of decreased perfusion, cool skin, weak pulses, hypotension. Administer oxygen therapy to increase myocardial oxygen supply. Ensure patient is in a semi-Fowler's position to reduce cardiac workload. Administer prescribed antiplatelets, aspirin, beta blockers, or calcium channel blockers. Educate the patient on the importance of medication adherence and lifestyle modifications. Nursing diagnosis, anxiety related to fear of heart attack and chest pain. Interventions. Provide reassurance and emotional support. Encourage slow, deep breathing to reduce anxiety levels. Involve family members to provide support and comfort. Educate the patient about the nature of angina, its management, and prognosis. Nursing diagnosis, activity intolerance related to imbalance between oxygen supply and demand. Interventions. Encourage gradual increase in activity with frequent rest periods. Monitor heart rate and blood pressure during physical activity. Educate on energy conservation techniques to prevent angina episodes. Collaborate with physical therapy for cardiac rehabilitation exercises. Nursing diagnosis, knowledge deficit related to disease process and self-care. Interventions. Explain the pathophysiology of angina and how to manage symptoms. Teach proper use of nitroglycerin, including when and how to take it. Educate on dietary changes, such as reducing saturated fats and sodium. Discuss the importance of regular follow-ups and monitoring risk factors like hypertension, diabetes, and cholesterol levels. Prevention. Lifestyle modifications. Maintain a heart-healthy diet, low in saturated fats, cholesterol, and sodium. Engage in regular physical activity, at least 30 minutes of moderate exercise most days. Maintain a healthy weight to reduce cardiac workload. Control of risk factors. Manage hypertension through diet, exercise, and medication. Control diabetes with proper diet, medications, and regular monitoring. Maintain healthy cholesterol levels, increase HDL, reduce LDL. Smoking and alcohol cessation. Avoid smoking and second-hand smoke exposure. Limit alcohol consumption as excessive intake can increase blood pressure. Stress management. Practice relaxation techniques such as meditation and deep breathing. Avoid excessive stress and engage in stress-relieving activities, yoga, music, hobbies. Medication adherence. Take prescribed anti-anginal medications, nitroglycerin, beta blockers, calcium channel blockers, regularly. Adhere to aspirin or other antiplatelet therapy to prevent clot formation. Regular health check UPS. Monitor blood pressure, cholesterol, and blood sugar levels regularly. Undergo periodic ECG, stress tests, and cardiac evaluations as advised. Avoiding triggers. Avoid heavy meals and extreme temperature changes that can trigger angina. Limit caffeine intake and excessive exertion. Emergency preparedness. Always carry nitroglycerin if prescribed. Learn to recognize early signs of angina and seek immediate medical attention if needed. Complications. Myocardial infarction, heart attack. Heart failure. Arrhythmias, irregular heartbeat. Sudden cardiac arrest. Conclusion. Angina pectoris is a serious condition that indicates underlying heart disease. Early recognition and management are crucial to prevent complications such as heart attacks and heart failure. Lifestyle modifications, medications, and interventional procedures play a key role in controlling angina and improving the patient's quality of life.
So guys, thanks for watching my video. You can like and comment on my video, but don't forget to subscribe my YouTube channel to watch quality content like this. Thank you guys.